Hello, thank you for taking the time to watch this educational video to prepare for your knee replacement surgery. I'm very thankful that you chose me to do your surgery. I'm very appreciative you put your faith and trust in me and my staff at Sports Medicine and Joint Replacement. This video is designed to take you through the pre-op, intra-op, and post-op phases of care so that you're comfortable with what you will experience and confident that you will do well. I encourage you, as well as any family members or friends that may be helping you after surgery, to watch this video several times as you go through these phases, and you will focus on different aspects as you move through the process. You will be classified as a type 1, type 2, or type 3 patient. Type 1 patients are very healthy with no medical issues and should be discharged on the day of surgery as an outpatient. They will go straight to outpatient physical therapy starting the first Friday or the following Monday after surgery. This will be set up prior to surgery. Type 2 patients have some stable medical conditions and are our most common type of patient. They will either go home on the day of surgery as an outpatient or the next day by lunch. We will still recommend that they go straight to outpatient physical therapy like our type 1 patients. However, in some situations, we will set up home health physical therapy for the patient to get a few visits at home prior to starting outpatient therapy. Type 3 patients have multiple stable medical issues with minimal home support. They will stay overnight and typically discharged by Tuesday at lunch. Occasionally, they may need to stay a second night in the hospital. They may have some home health physical therapy and then progress quickly to outpatient physical therapy. Prior to surgery, Lisa, my case manager, will plan out your post-operative care. I do not recommend skilled nursing facilities after surgery. You'll need less assistance than you might think, and it has been proven that people do better when they return home after surgery. I recommend getting into outpatient therapy as quickly as possible. This begins typically 5 to 7 days after surgery. Depending on your level of support, we still utilize a limited amount of home health therapy if needed. Again, Lisa will take care of all of these details prior to surgery. She is your point of contact for questions regarding surgery scheduling, post-operative appointments, including where you will do therapy and when that will start. You will have a preoperative history and physical exam with my physician assistant, Colby Robbins, on the Friday 10 days prior to surgery. This is mandated by insurance and serves as a good time of education and getting all the paperwork in order for surgery. It is a good time to ask as many questions as possible and would be helpful to bring your primary caregiver that will be assisting you after surgery. If your surgery is scheduled for Wesley Long Hospital, you will have a pre-admission appointment 1 to 2 weeks prior to surgery. You will meet with anesthesia, have labs done, and discuss your home medications. If your surgery is at the Surgical Center of Greensboro as an outpatient, your primary care provider will take care of the preoperative lab work for you. If there is any question or concern about anesthesia or your home medications, please ask Colby at your H&P appointment. A few days prior to surgery, a company will bring a continuous passive motion machine, which we call a CPM machine, to your home and teach you how to use it. You will be in the CPM machine for 6 to 8 hours a day in the hospital and for 2 weeks following surgery. The device will aid you in quickly regaining the ability to bend your knee. It is also good to figure out prior to surgery where you will sleep when you return home. Oftentimes, patients will set up a bedroom downstairs. Additionally, it is wise to remove any carpets you might trip on, and we advise patients to make any arrangements that will help you after you return home from the hospital, such as grocery shopping, laundry, computer charging, books, and other arrangements for easy access. Your surgery will be on Monday morning. You'll need to arrive at the facility 2 hours prior to your scheduled time of surgery. I will come see you in the preoperative holding area and answer any last-minute questions, as well as sign your leg and the consent form. The anesthesiologist will do a block on your leg to make it numb for surgery, which helps significantly with postoperative pain. You will then head back to the operating room where you will be prepared for surgery by nursing staff as well as Colby. We typically do spinal anesthesia, which has tremendous benefits for a rapid recovery postoperatively. Your family will be taken to a waiting area, and then I will speak with them as soon as I am finished. You should have your first physical therapy session a few hours after surgery once your legs have fully regained control and feeling. It is very helpful in getting you moving to orient you to the equipment that you will be using, such as your CPM machine, your walker, your bone foam, and ice packs. Your leg will either be in the CPM machine for 2-hour shifts or in the bone foam pillow with an ice wrap for 1-hour shifts. The key to success is constantly working on bending, which we call flexion, and straightening, which we call extension. The rhythm to this would be to get in the CPM machine starting at 90 degrees for 2 hours. You will then get into the bone foam and have the ice on your knee for an hour. You can take a break in between and you're to get back into your CPM machine. The goal would be for you to complete this cycle at least 3 times during the day. If you struggle with 90 degrees in the CPM, which especially may happen on the first post-operative day, you can back down to 60 degrees, but then progress quickly back to 90 as tolerated. Similarly with the bone foam pillow, if an hour is too much, you can back down to 30 minutes and then over that first week progress to 60 minutes in the bone foam. Of course, in order to do this post-operative range of motion protocol, we have to do a great job managing your pain, since working on gaining full flexion and full extension in these devices can be uncomfortable at times. Pain management is achieved by a number of measures, including the preoperative block, intraoperative numbing medicine placed in your knee at the time of surgery, and post-operative pain medication. It is critical to communicate with the nursing staff as well as Colby regarding your level of pain. We try to get people home as soon as possible. It has been proven that you will sleep, eat, and be more comfortable in your home environment. We have progressed to the point where most patients are done as outpatients and return home on the day of surgery. So most of you will go home Monday afternoon after Monday morning surgery, but some will need to spend the night and be discharged on Tuesday morning, certainly before lunch. This depends on how well your pain is managed and if you have passed physical therapy. Colby will send in all of your prescriptions so that your caretaker can go by the pharmacy prior to picking you up. He will call in pain medication, a muscle relaxer, and an aspirin, and the aspirin is really just for clot prevention in the legs. Again, we do not recommend skilled nursing facilities. However, if there is simply no other option, you may end up staying an additional day in the hospital. And again, while we do not recommend a skilled nursing facility because there is increased risk of complications, sometimes we have to use those. Home is certainly the preferable option. We also do not typically recommend home health. However, if you have been set up for home health physical therapy, your therapist will arrive the day after you get home. Typically, they will come a couple of days before you will rapidly progress to outpatient physical therapy. Again, we try to get people into outpatient physical therapy as soon as possible. You will typically start outpatient physical therapy 5 to 7 days after surgery. We will attempt to schedule those appointments prior to surgery so there is no delay in getting you in to the therapist. They are very familiar with how we like therapy to be done, and you will be well taken care of. Please let us know if you have any trouble making those appointments, as we do not want any delay or gaps in your post-operative course. Colby and I will see you back approximately 10 days after surgery. At this appointment, we will usually get x-rays of your knee, check your wound, remove your waterproof dressing, and refill any pain prescriptions and go over therapy progress. Please make sure you bring a progress report from your therapist. They can fax it if they want, but we definitely want you to bring a copy of that to your appointment. If you have any questions prior to surgery or after surgery, please call our office at 336-333-6443 during business hours, which are 8:30 a.m. to 4:30 p.m. Monday through Friday. After hours, there is a doctor on call that you can speak with. However, we would prefer to talk with you ourselves. No question is a dumb question. Our goal is for you to be completely educated and comfortable with the entire process. We are happy for you to come to be checked any day of the week after surgery, in addition to your regularly scheduled appointments if you feel the need. We do not want you to go to the emergency room unless it is an emergency, and these are very, very rare. We prefer to talk with you prior to going to the emergency room, and again, those appointments are extremely rare. I have an exceptional staff. You will get to know them very well by name, and I encourage you to ask them as many questions as you have and at any time. I encourage you to meet them, as they are wonderful people as well as wonderful healthcare professionals. Thank you for allowing Sports Medicine and Joint Replacement to care for you as you have your partial or total knee replacement. We are committed to making this a great experience for you. We encourage you to watch the video before surgery and several times when you get home to remind yourself of the different elements and phases of your care. All of our educational videos can be found on our website at www.smjrortho.com, or you can also get there by going to www.drlucey.com. And once again, if you have any questions at all, please let us know, and thank you.